active immunotherapy activates the immune system using a vaccine. Immunogens derived from the patient's tumor cell are administered to the patient, or they directly stimulate an immune response to the tumor.
With this first vaccine, blood is extracted from the patient. Specialists then isolate dendritic immune cells from the blood and combine them with certain stimulatory proteins. This vaccine is then injected back into the patient's blood, and the modified immune cells train T cells to kill tumor cells. T-cell therapy is an active immunotherapy that involves extracting the T-cells from a patient's blood. Researchers can increase the amount and/or modify T-cells to be more effective in fighting cancer cells. They do this by modifying the T-cells and giving them new receptors against tumor antigens that are more effective at detecting and killing cancer cells. These modified and activated cells are then injected into the patient's vein and create a stronger and more effective immune attack against the tumor.
Passive immunotherapy for cancer most often involves the development of monoclonal antibodies, MAB, specific to tumor antigens or molecules such as hormone receptors or other cell surface proteins that stimulate the growth of tumor cells. Often, the MABs interact with T cells to effectuate tumor cell killing.
Survivors of certain cancers donate their blood. These donors' immune systems already made the antibodies to fight cancer, and these antibodies remain in their blood. These antibodies are then extracted from the blood and purified using biotechnical technologies and administered to the patient. These antibodies then bind to the tumor-associated antigens and mark that tumor for death. Antibody-drug conjugates, ADCs, are preformed antibodies to cancer antigens with a cytotoxic drug attached. There are three parts of the antibody-drug conjugate: the specific antibody that attaches to the cancer cell, the payload or the cytotoxic drug, and the linker that attaches the payload to the antibody. The antibody attaches to the antigens on the cancer cell, and the cell absorbs the drug, which then kills the cancer cell. Quite a few ADCs have been approved so far, and they have hopeful outlooks.
Most of these treatment options are new or undergoing FDA approval, which is why immunotherapy is one of the most exciting developments in cancer treatment right now. It could save millions of lives and add years or decades onto patients' lifespans.